Even on healthcare, something often seen as critical, there are some money-saving options, and Fox 4's Matt Grubbs has a look at one such plan, so-called consumer-driven healthcare.
For millions of Americans,
it's going to be very complicated, and the average person hasn't got a clue, let's be honest.
it is time, once again, to choose a healthcare plan at work.
PPO, HMO. I don't know what else there is.
What's the difference?
I don't know.
I don't really know, seriously.
As employers search for lower healthcare costs and employees do the same, so-called consumer-driven health plans are appearing as an option.
Do you have a deductible?
Jennifer Burke's family has one.
With a little kid, we tend to meet the deductible every year, but that money carries over from year to year, so we always have it.
The plans have a higher deductible, but usually a lower monthly premium. They are almost always connected with a health savings account, an HSA. That account rolls over each year and goes with you if you leave your job. And the money is tax-free.
Yep, it's pre-tax, and so that's always a benefit. And it's just there when we need it.
At the University of Texas at Dallas's School of Management, former Dr. Forney Fleming says only 8% of covered workers choose high-deductible or consumer-driven plans.
They are somewhat difficult to understand, and because of that, it's difficult to market it to consumers.
The big selling point for consumer-driven health plans has been the HSA, the health savings account, which allows people to save for future health care expenses. Being able to roll over those savings for health care expenses is a big part of why some people look to high-deductible health plans. But they also hinge on the consumer being able to find information, and their experts say the system often falls short.
The information that is really necessary for a consumer to make an informed consent in terms of cost and quality is not out there.
Fleming says it'll take decades for that transparency to arrive. If and when it does, consumer-driven healthcare plans may not look the same.
So many things are mandated to be covered under these plans. The high-deductible health plan actually leaves those choices up to the individual.
Congressman and Dr. Michael Burgess favors consumer-driven plans, but he says their place in the healthcare system that could emerge from Washington is uncertain and at times seems at odds with reform plans. Critics say consumer-driven plans favor healthier, wealthier users and are not the answer for everyone. They don't seem likely to be the wave of the future, but for now remain a lower-cost option. Matt Grubbs, Fox 4 News.
The University